Okay, friends, we're going to move on to our next segment here. This segment is going to be presented by two co-presenters. I just want to introduce them briefly before they get up and rolling. From North by Northeast Community Health Center, we have both Sharetta Butcher and Dr. Gina Guillaume. Sharetta Butcher was born and raised in Portland and is a certified community health worker for the state of Oregon. She's been with North by Northeast Community Health Center for 12 years and is the proud mom of three grown adult children and seven grandchildren. Yet she still has time to be here this morning. I don't know how that works. Sharetta just recently got married to a wonderful man that keeps her smiling and laughing all the time. Sharetta says, I thank God every day for blessing me with such a passion and love for his people. That is why I enjoy my job and serving the community. Dr. Gina Guillaume is the current medical director of North by Northeast Community Health Center, joining the team as its first Black medical director almost a year ago. She is the daughter of two hardworking Haitian immigrants who raised their four children in the Bahamas. Dr. Guillaume is a graduate of Howard University College of Medicine and obtained her family medicine residency and community health fellowship training from Harbor UCLA Family Medicine Program. With a passion to reduce health disparities and a commitment to empowering underserved populations, she is ecstatic to present this talk to you all this morning. And we are ecstatic to have her and Sharetta. My friends, please take it away and welcome them.
Yes, thank you so much for that introduction. What an amazing opportunity to be here. As stated, my name is Dr. Gina Guillaume, and I'm here with my colleague,
Sharetta Butcher. Hi, everybody.
and we're proud to present this equity and medications, the cultural challenges impacting the medication experience. And we could go on to the next slide. So this is going to be a great time today. And thank you all for joining and tuning in. But this is just an overview of some of the things that we will be discussing, such as our mission here at North by Northeast Community Health Center. And we're going to give you a personal outlook and experience on our experience with our population so far and things to consider with medications, things that have come up, and also some solutions that we've put forth and that we see have helped our community. And of course, we would like to leave you with key pearls at the end and takeaways. So I'll pass it on to Sharetta to talk about our mission.
Okay. North by Northeast Community Health Center is the only medical clinic in Oregon that's devoted to African American Black health. We exist to improve the health outcomes and advance health equity by offering primary care services and health education to promote and focus on the African American Black community. Right here in the middle, you'll see our co-founders, Pastor Mary Overstreet Smith and Dr. Jill Ginsburg. How North by Northeast was created was Pastor Mary sold her vacation home during the Hurricane Katrina, the disaster of the Hurricane Katrina. She went down to the Gulf and she brought back about 10 families to relocate here in Portland. And Dr. Jill, I guess the news was doing a special on Pastor Miriam, and she was collecting a lot of donations and clothing and stuff like that for the families. And Dr. Jill seen it on television, and being the wonderful person she was, gathered a bunch of stuff to take over to the church from her friends and her neighbors. And she was just dropping some things off. And I guess Pastor Mary had said if there was a doctor that came through, let her know. And so when Dr. Jill went to go drop all the items off, Pastor Mary, someone went and grabbed Pastor Mary, and her and Dr. Jill went for a little walk down the street to this little house and start talking about a medical clinic. And that's how the clinic started. Two wonderful women with a passion for people and community, and North by Northeast was formed. And as you can see, we have grown out of two locations from a little house, and then we moved on MLK and grew out of that space. And now we're over here on 7th in Alberta. And through that, it wasn't just a medical clinic, but we also grew into various other things as we did outreach services. We went to Jefferson High School and we started a program working with young people and teaching them about different fields in the medical field, kind of to try to, stir them into healthcare. We started the Cuts and Checks program. We have Safe Home, Healthy Homes. We have outreach program. We were working with medical students to come and shadow our clinicians. So we're not just a medical clinic, but we have also reached out into the community in other various programs.
Thank you so much, Sharetta, for that introduction. And now we will take a look at some considerations that are coming up and our view here at the clinic. We can go on to the next slide.
Mm-hmm.
And I'm so happy that we have phrased this discussion around equity and not equality. And I love this picture. It's taken from the Interaction Institute. But it is important for us to differentiate what is the difference between equality and equity and what that means. So on the photo to the left, you can see equality is giving everybody the same opportunity, the same resources, and expecting that everyone is going to have the same outcome. And that's not the case. As you can see, the person who is shorter, even though they have the same resources as the others, they still are not able to see over the fence to watch the game. It's important because I feel like this is a great representation of the African American experience in the United States of America when it comes to that short person. As we know, we have, as an African American people, spent 246 years enslaved. Followed by that, we had 100 years of Jim Crow, where Blacks were not allowed to attend the same schools or drink from the same water fountains, or even go to the same hospitals as other races. Because of that total of 346 years of oppression and enslavement, that definitely had an impact on the African American people. That Civil Rights Act was not passed until 1964. And friends, that was only 58 years ago. So we've spent 6 times the number oppressed and enslaved than we have being liberated. So because of that, at North by Northeast, we understand that it's going to take 6 times the effort to liberate our people than it did to the same 6 times it took to oppress us. So for that reason, we definitely dedicate resources, energy, time into building up our African American community and giving them the resources they need to truly see over the fence. And we could go on to the next slide. So I did want to highlight some experiences that have come up so far from my time here at North by Northeast Community Health Center. Number one, in general, a lot of our patients are pill averse. Essentially, they are afraid or do not like to take medicine. And as I stated, because of the reasons of oppression, discrimination before, there is, and also their personal experience with racism in the medical field. We have a lot of patients who have moved from the South, like Arkansas, Mississippi, et cetera. But some of those patients have commented, that they have experimented on us growing up. I don't trust these pills. Or, they don't, when they used to go to the doctor before, they were dismissed. Their concerns weren't taken seriously. They were spoken down to. Just as Oyinda mentioned, the impact of that is that a lot of our patients are just afraid to take the pills. There are also some patients who would prefer to do alternative options than pills, such as herbal supplements or teas that they got from their family members. And as a provider, I think this is where our motivational interviewing skills do come in handy. I remember I participated in a workshop on motivational interviewing recently, and the moderator mentioned, if you were at your worst and you reached out to a friend, what characteristics would you like to hear from that friend to allow you to open up and share what you're experiencing? And then what characteristics may not be helpful? So as a provider, that stood out to me because it's a reminder that when patients are bringing up concerns that may oppose what we are trying to give them, it's important for us to listen, to be non-judgmental, to hear people, to not be pushy. And I do think that's important. And I have seen the impact of that on a lot of our patients. For instance, this one man, I remember after having a conversation with him about not taking his high blood pressure pills, over time, as I build the relationship, his blood pressure has now been controlled, and he's ring the bell here at our clinic to say so. And then another woman who was not taking any diabetes medicine, and her A1C was at 12%. And she did not want to take any pills. But over time, as I listened and talked to her, her A1C dropped down to 7.9. Like, she started taking her pills over time. Another thing that comes up is cost. So one thing that it's worth mentioning, here at North by Northeast, we only take OHP insurance, which is the state's version of Medicaid. So what that means is that we serve low-income communities, and a lot of our patients can't afford over-the-counter medicine. And I know that when we are prescribing formulary medications, we rely on that, but sometimes those aren't covered, and they have to opt for the over-the-counter medicine, and we think that that's okay. But I just want to start to make us think about that today, that not everybody can even afford over-the-counter medicine. And for that reason, here at North by Northeast, we've actually kept certain over-the-counter medications and creams in stock. So we would give it to our patients if they were having trouble. And I love our formulary list. I appreciate that we have that available, but there are certain medications that are just not covered. For instance, I run into trouble as a provider with our topical steroids. I think the betamethasone ointment isn't covered, and certain inhalers are not covered as well, like Symbicort, I believe, is one of them. So if for our asthmatics and our patients who have eczema, sometimes it is challenging when they can't afford those medications. Another thing to consider that's coming up as well is incorrect dosing and timing. This is important. I remember a patient was having headaches with his amlodipine. That's a blood pressure medication. And eventually he was running out of his refills. He was running out of his refills too soon, and we couldn't understand why. He let me know. He said that, you know what, doctor, I think I was taking the medicine incorrectly. Instead of once a day, I was doing it twice a day. So we were able to talk about that and communicate, how to move forward. But that is something that for me stood out, is that I do need to be very intentional about, as Oyinda mentioned, communicating the dosing and timing, because health literacy does come up. Automated refills. We think that that is, helpful, and it is in a lot of cases. But the danger of this is that sometimes when we discontinue medicines as providers, the pharmacy doesn't see that automatically. So what happens is our patients keep getting refills of a medicine we discontinued. So ways that we've, combated that is when we are getting requests electronically is to refuse the medicine and say why, if we are paying attention to that. But sometimes it may take intentionality to communicate with the pharmacist as well that we've discontinued a medicine. And one other last consideration is just overwhelming pill burden. Our patients definitely sometimes, for those who are, having a lot of chronic conditions, it gets overwhelming to be on so many pills that the reflex action is to not take them at all. So that is something to consider, and for us to try to use combination pills and minimize that when we can.
Solutions, not believing that this is all the solutions, but these are some of the solutions that we, North by Northeast try to really work hard on. And if I could, I would take building trusted relationships and put them in each of these categories. But one of the biggest things I do know that we work hard on is building trusted relationships with our patients. And if you have a patient that you know is struggling with their medications, and you built a relationship with them. One of the things as a community health worker that I used to do is being able to go and do home visit. Having a home visit with a patient, is phenomenal, because you're invited into their life, so you get to experience what they're doing. And I remember being able to go and have a home visit with one of our patients, and who was struggling with their medications. Blood pressure was always high, and so it was like, hey, well, let me come over to your house and take your blood pressure each week, so you don't have to come to the clinic. Let me come to you. So that was like, oh, perfect. Oh, come on over. So they invited me in, which allowed me to be able to also go, hey, well, let me see your meds. How do you take your meds? And she went and actually got a toolbox, where she came and opened up this toolbox, and inside the toolbox wasn't just her medications, but her two daughters' medications as well. And inside, I said, so what happens when you get ready to take your medicine? And she started pulling out her bottles and looking at them to say, oh, I take, well, okay, this is, and then when I take, and then in the evening, I go in and I put, and it's like, but there's no way that you can take this, correctly, because some of the bottles were empty, some of the bottles were her kids. And so we separated her medicine from her kids' medicine. So we put the kids' medicine in a different spot, and we focused on hers. And so then this took some weeks. It wasn't a one-time visit, and we figured this all out. We figured out what she should be taking. We got her correct med list from the doctor, and then we figured out like what she was getting from the pharmacy. So she was on the automatic refill list. So she said, whenever they call and tell me my medicine's ready, I go pick it up, and and I just take it. Well, some of the medicine had been discontinued. So it was like being able to kind of reconcile her medication with her at home and figuring out what she needed was like phenomenal. And it helped her, because she was also telling me that she was falling asleep at work, and she was taking one of the medicines that she should have been taking at night because it caused drowsiness. And so some of this doesn't happen like in the doctor's office, when you have your 10, 15, 20 minutes with the patient. You don't get that time to really reconcile medication. You may have to do that in a trusted relationship during a home visit. So organizing pill organizers, will that help her? Did that help with her? Yeah, later down the road. It didn't happen instantly. So some of these stuff we have to work really hard at trying to make fit that person. So you have to sometimes may have to sign a one-on-one, either the MA or community health worker, to work with that patient to help them get their meds reconciled so that they can start taking stuff correctly. And that kind of really helps with the patient to, lower, not won't say lower, but help me, Dr. G, bring that gap, lower that gap together, so that the patient is actually, lowering the disparity with that patient being able to, really focus in on becoming healthier. And her blood pressure to this day now is really good. Her blood pressure is controlled, and she's doing a lot better than she was before. And found out that we could even get her off of some of those medicines that she was taking too. So that works really, really well.
Yes, thank you, Sharetta. And I would just like to continue on more things that have worked and things that we're still working on here at the clinic. Bubble packs. I would like to point out that this has actually been very effective for our patients who need more attention and having trouble keeping up with how they're supposed to be taking their pills. So certain pharmacies will pre-package our patients' medications for them so that they won't need to open up any like pill bottles. So not only do they like pre-package the pills for them in a sealed container that they can just open and take, but there is also an option to mail it out to our patient. So when we talk about social determinants of health, that captures a lot, such as access, such as transportation. What if you don't have a car to go to the pharmacy. So I feel like paying attention to these modalities is very helpful, and some patients have greatly benefited from this. Here at North by Northeast Community Health Center, our patient service coordinator / front desk person, she created a med wallet, or basically, I shouldn't say created, but she's allowed us to use it more. It was already something that was being used by other facilities, but she introduced that concept here. So essentially, a med wallet is where you would have the patient come in, someone that you are trying to help with taking their medications, or who may have issues with health literacy. They can come in and sit down with one of our staff members, who will then write down the names of the medication, how they're supposed to be taking it. And not only that, there is a column that states why you're taking it. What is this medicine for? So that is something we've started to adopt here at the office, where patients can come in. And I really do think this helps with literacy and community and trust. So all of that plays a role as well in helping our patients keep or promote equity with their medications. As I stated, cost is a big issue, and I feel like we should not neglect that. One resource that has helped to cut down on certain medications is a coupon, the GoodRx coupon. And this is a free universal tool that people can either look up. We even keep the GoodRx cards here at the office, where we hand them to our patients. So for certain medications that are uncovered, or if it's just very expensive, this can help to reduce the cost. We've also found out about Array. This is another coupon tool that can be used, and this is in this Array is found in the states of Nevada, Washington, and Oregon, I believe. But these are just other ways that we can really help our patients to keep up with their medications. Next slide. All right, so we said that, you know, if you didn't take anything from this presentation, we wanted to leave you with some key pearls, meaning that please, if you can, try to remember this. So I know that we discussed, you know, the culturally specific lens from an African-American experience, because that is the population we aim to serve. But it's important to know that the tips that we've reviewed today can be used for all. It can be used for all people. And it does help in general to be kind and non-judgmental and listen and take that extra step to help underserved and minority populations as well.
So if one of the other things is to seek opportunities to minimize medications. If there's if you can, use a combination pill if that works for your patient. Sometimes it's easier for a patient to take one pill than it is for them to take two. If you can, discontinue some of the meds that they're on. Just take a couple minutes and try to see like an overview, like, do they really need this medication? Sometimes, you know, a patient may come in with an ache, or, you know, a body ache or something, and you prescribe something, and sometimes you may go like, are you still dealing with this problem? And if they're not dealing with the problem anymore, maybe they don't need the medication anymore. And sometimes, you know, you can make, you know, frequently go over their med list with them, reconcile their med list with them in the office. I know it adds to the time. We don't have a lot of time working with patients. I know that, but people will hear a lot of that. But if you can, especially with those who are really struggling with their meds, taking their meds, if you can at least frequently do that, like, you know, at least once a month with them, it would be really good. You know, adding some extra time in there with the patient to reconcile their meds at the office would be really a great opportunity for the patients.
And also closing the loop, that's very important, especially when we are discontinuing medications. This may require some support staff, such as an MA, for instance, or a mid-level provider, but that is something that I'm learning to pay close attention to. And also when I'm getting requests for refills, to really look at the chart too, to see if this medication should be continued or not. And before I move on, I just wanted to comment that the combination pills works really well for high blood pressure medication. So trying to find combinations of those. And I can't stress that it takes a village. Here at North by Northeast, we have a great team. So our medical assistant, our community care coordinator, our friend desk, everybody is an integral member of this team that helps us to outreach to patients and fulfill a lot of these duties that we've just said.
Build relationships is a key. And if you know, it starts from, like Dr. Guillaume was saying, like, we have a great team, and it does. It starts from the front door all the way to the back office. And we don't judge anyone. Sometimes, you know, a patient may come out of the out the doctor's office and then walk into my office and say, hey, I don't understand this, because they may have a better relationship with me. So it becomes, you know, being able to explain and go over their after visit summary. And it's like, you know, just whoever that person has that relationship with, you know, bring that person in with them. Don't cause any judgment on them. If they don't understand, make it easy for them to understand. I know sometimes we use medical terms that even sometimes I have problems reading some of the medications, and they don't even know. So they'll say something like, I don't know, it's that little purple pill, or is that little white pill? I'm taking that little white pill. Well, I don't know what that is. And then you say, well, is it, you rattle off the name, and they go, I don't know what that is. And then I'll say, well, go get the pill bottle and start, you know, just spell it out to me. And then they'll do that. And then I say, oh, okay, I know what that is. And so it's like no judgment, you know, that they don't know how to read what that long word is. So, you know, it just makes a person feel comfortable and easy for them to talk to. So we don't do any don't pass any judgment on it that they don't know or don't know how to read what they're taking, but make it easy for them to be able to relate to you that what they're taking.
And I can't stress it enough. We can't stress it enough. Social determinants of health matters. Mm-hmm. And honestly, what happens outside that exam room accounts for like 90% of outcomes related to access to care, food insecurity, etc. So for us, we pay attention to that, and in ways that we can help, we do look for opportunities to assist our patients. Especially when it comes to, I think you could click on the next one, Sharetta, when it comes to over-the-counter assistance.
Mm-hmm. So we just want to thank you so much for having us with you this morning. And any questions, I think you'll be able to put them in the chat, like Paul said. And I think we just want to say thank you.
Thank you.
Wow. Phenomenal, you two. Thank you. Thank you so much for making time to share your experiences with us today. In particular, thank you for all the work you're doing and for the incredible example that you're providing for all of us about how to better engage with patients. It's just remarkable. So Sharetta, Dr. Guillaume, thank you. This was really, really outstanding.